Good afternoon. My name is Lisa Henderson, and I am going to present Week 2 Technology Challenge. Many patients admitted to the hospital require venous access. Patients with a history of chronic or complex disease, who are obese or malnourished, or who have a history of IV substance abuse are likely to have difficult venous access. These patients often have non-visible or palpable veins requiring multiple painful attempts at peripheral IV placement. Multiple attempts can increase patient anxiety and suffering. It can delay vital treatment and also increase costs. Ultrasound-guided peripheral IV placement is a strategy to maintain vessel health and preservation for all patients, but particularly for those who have difficult venous access. Our organization's emergency department recently purchased the Preview Plus. The Preview Plus is an ultrasound system designed to facilitate real-time placement of peripheral vascular access. This portable device features a 2D real-time ultrasound imaging that is of compact size and has a simple interface. The IV mode is designed to assist clinicians in selecting the appropriate IV catheter length and gauge for a target vessel. Ultrasound-guided peripheral IV placement can positively impact our patient experience by increasing success rates of peripheral IV placement, provide faster delivery of care, eliminating the delay that multiple attempts cause, and reduce costs as clinicians utilize less supplies. Let's take a closer look at each of these three. First, we have a higher success rate with guided ultrasound. Guided ultrasound imaging increases the placement success rate over traditional blind stick for peripheral IV catheters. Multiple attempts at placement or placement of IVs in high flexion areas, such as the elbow or the wrist, which is common among those with difficult access, increases the risk of phlebitis, thrombosis, and catheter-related infections, all of which may result in the need for new access. This leads to further painful and often unsuccessful attempts to place another peripheral IV. Secondly, we can offer a faster delivery of care to our patients. Difficult peripheral IV placements require multiple attempts and can delay delivery of care. Clinical implications include delay in diagnosis if important laboratory tests are required, delay in the start of treatment as attempts to start IVs are unsuccessful, and the patient not receiving their treatment in a timely fashion. They may even miss medication doses due to lack of access. Treatment delays place our patients at higher risk for complications and/or worsening symptoms. Thirdly, with guided ultrasound, we can reduce our overall healthcare costs related to peripheral IV placement. Repeated attempts at peripheral IV placement is costly to patients, caregivers, and the healthcare system. Decreasing attempts at placement will reduce supply use and the time staff spend placing IVs. The Preview Plus is designed to assist in the successful placement of peripheral IV catheters by helping with the assessment of peripheral vasculature prior to starting an IV. The Preview aids in identifying what vessel and anatomical location is best to access. There are many advantages to using the Preview Plus ultrasound system. It provides an assessment of vasculature prior to attempted access, provides real-time guidance, it can provide the depth and size of vessel information, and the ability to visualize the vasculature, which can assist in the identification of bifurcations, valves, and tortuous curves, which all may lead to missed placements. The basic mode provides a clinician with an ultrasound image with depth and center mark indication. The advanced mode displays the approximate length of the vascular access device that will be in the peripheral vessel upon final placement. Overall, the Preview Plus can improve our patient care experience by decreasing multiple attempts, which lead to vessel damage and patient anxiety, improve the overall health of this patient population who have difficult venous access by facilitating care delivery, and reduce healthcare costs as supply use decreases with single attempt peripheral IV placement. Thank you for watching.